59 in Foley, Alabama.
This morning, Dr. William Higgs joins us on Studio 10. Dr. Higgs is with Springhill Medical Center's Center for Wound Care and Hyperbaric Medicine. Good morning.
Good morning.
How you doing?
Doing great.
All right. First off, there are many different types of wounds, also chronic wounds. Talk to us a little bit about how wound care is often overlooked.
The real issue is the diabetic who has the diabetic foot ulcer. His foot is insensate, meaning that he has no feeling. It usually goes with the diabetic neuropathy. They end up with ulcers and then finally discover it, wondering why their foot smells bad. And then they show up at either a podiatrist's office or see us in the wound clinic, and then we go from there. And one of the issues with that wound is not only is it associated with the diabetes, a lot of times it's associated with peripheral vascular disease and their blockages, and if they're not addressed, then that person can lose his or her foot or leg. And one of the things we're trying to prevent with this wound care is loss of limb. And the group, all of the wound care centers here in Mobile are members of what's called Save a Life, Save a Limb. I think that's great. Either Save a Limb, Save a Life, but it's called SAL. And it's a totally nonprofit organization, and the idea is that we should be vigilant at all times for wounds such as this to try and prevent loss of limb, because those patients who lose their limbs have a significant mortality rate at 2 and 3 and 5 years.
Well, on that note, are there any sorts of tests we can do to figure out why a particular wound isn't healing?
Well, first of all, a good history and physical, and any physicians listening will be probably as tired as I am of hearing that, but you always start off a good history and physical, and sometimes that's not done. Sometimes people are in a hurry, but you've got to listen to the patient, then you got to examine them. The first thing you need to do in the foot is to feel their pulses. If you can't feel pulses and you have what's called a Doppler, you can listen for them. If you can't hear pulses, then they need to go to the vascular lab and have what's called a duplex exam done of their lower extremities to see what the blood flow is. If that's abnormal, then they need some sort of study where dye can be placed in the vessels, and you can find the blockages, and either an invasive vascular surgeon such as myself or invasive cardiologist can deal with that.
Wound care is treated case by case. Talk to us about individualized treatment.
Well, that depends on what you see. You can see if, the one that people like to talk about in the summer is the brown recluse spider bite, which looks like a black fried egg. The yolk is black, and that's called necrosis, and then there's a red center, a red margin around that, and then it changes colors, and that you can lose a lot of tissue. There's the people who step on things, they get infections in their feet. They can get Clostridium, which is from tetanus. Then they would need potentially the hyperbaric chamber to kill that particular bacteria. So we see multiple wounds. There are venous stasis ulcers where people have varicose veins, and the venous return is impaired up into the leg, and so sometimes that pressure in the vein causes an ulcer to form on the ankle or anywhere on the lower leg, and then that can be a pretty nasty actor and would require not only antibiotic treatment by vein or by mouth, and also enzymatic debridement, which is a chemical that you put on the wound in order to digest and get rid of the infected tissue, and also the slough which occurs, so that you can clean it up, and then you put what's called an Uniboot on there or some sort of compressive stocking.
So are some of those treatments are what qualifies as advanced dressings? Are those treatment options you've talked about?
They are the beginning of that. Some of the really advanced dressings are if you put a biologic on there. There's several. There's Apligraf, which is made with stem cell research with human cells. There's a Dermagraph. There's an Oasis dressing, there's Alloderm, there's Integra, and then there's a product called Primatrix, which is made from fetal bovine skin, which is a particular favorite of mine because it's an amazing product that not only works well to cover up ulcers, which is not its main use, but one of its uses. I've used it to help close wounds in the leg where we've had issues with our surgery, with peripheral vascular surgery, where wounds break down, and that will enable the body to heal much faster. There's ingrowth of cells with that. There's some signal that comes from this scaffold, it's called a matrix, that stimulates the body's own stem cells to form whatever it is you sow it to. And I've been totally blown away with how it works and how well it works. But backing up a bit, all these dressings have particular places. And on a lot of patients, you'll use one for a while, and then the wound doesn't seem to respond, and then you use another product. It's almost like you're fooling it.
Right.
There's more advanced biochemistry than that to it, but they all have their place, and they're all really good.
Well, to find out what is right for you, or if you have any questions, you can contact the Springhill Medical Center's Center for Wound Care and Hyperbaric Treatment. Doctor, thank you so much for joining us here on Studio 10. We appreciate it.
Enjoyed it.
Thank you, guys. Spring is here, and that means it is